6.8, 9:13 a.m. Presentation of Proclamation designating the day of May 9th, 2023 as Fentanyl Awareness Day in Lake County.
And Supervisor Green, do you want to help out with this one?
Hello, my name is Ariana Covarrubias, and I am the reporter for Lower Lake FFA. Proclamation designating the day of May 9th, 2023 as Fentanyl Awareness Day in Lake County. Whereas fentanyl is a synthetic opioid that, according to the Centers for Disease Control and Prevention, is 50 times stronger than heroin and 100 times more potent than morphine. And whereas fentanyl use and poisoning impacts adults and youth of all racial, cultural, and economic backgrounds. And whereas, according to the CDC, 107,375 people in the United States have died of drug overdoses and poisoning. 67% of those deaths involved synthetic opioids, such as fentanyl. Many of those deaths are attributed to fentanyl being mixed with other substances, leaving many people unaware that they were taking fentanyl. And whereas, through acknowledgement of Fentanyl Awareness Day, Lake County creates a space for organizations, community, affected individuals, and family members to come together, sharing experiences as a whole group to counsel our youth and the public about the dangers of fentanyl. And whereas, with commitment and support, reducing fentanyl misuse and poisoning can be prevented. However, success will not occur overnight. Our patience and continued commitment to education and prevention are imperative. And whereas, while expanding access to fentanyl test strips and the emergency overdose reversal drug naloxone is critical to reducing fentanyl use, poisoning, and overdose. The stigma that surrounds drug use, addiction, and overdose often makes it difficult for communities to implement these measures and effectively address the opioid crisis. And whereas today, the County of Lake joins all those who have been affected by the fentanyl use in spreading awareness of the harm that fentanyl can cause, and reminds all community members that anyone can save a life by educating themselves on the signs of an overdose, learning how to administer naloxone, and calling 911. And whereas, the County of Lake Board of Supervisors and Lake County Behavioral Health Substance Use Disorder Services urges all citizens, families, governmental agencies, public and private institutions, businesses, healthcare, and education systems in Lake County to support efforts that will increase community awareness, understanding, and action to address fentanyl use and poisoning in our community. Now, therefore, be it resolved that the Lake County Board of Supervisors join with the Lake County Department of Behavioral Health Services, Substance Use Disorder Services, do hereby proclaim that May 9th, 2023 is Fentanyl Awareness Day in the County of Lake, passed and adopted this 9th of May, 2023.
Good morning, everyone. My name is Elise Jones. I'm the Deputy Director of Administration for Lake County Behavioral Health Services. Unfortunately, Lake County is on the front lines of the fentanyl crisis and the opioid crisis. We have at least the first or second highest rate of opioid overdose in the state of California per capita. These are mothers, fathers, sons, daughters, aunts, uncles. These are our community members. And the biggest medicine that we can offer is prevention. We know that people who struggle with any type of substance use disorder, particularly opioid use disorder, overwhelmingly have a history of child maltreatment. That's not everybody, but overwhelmingly we know that a history of a rough childhood confers a risk for later mental health and substance use disorders. So The biggest and strongest thing that you can do to invest and make sure that we can overcome this crisis is to invest in your children, to make sure that we have safe and strong communities, to make sure that our kids feel connected and loved. That being said, Lake County Behavioral Health Services does offer a wide range of services, and we implore anybody to come and connect with us who needs help. Also, don't be afraid to get trained on the use of Narcan. As was stated, a lot of people take fentanyl and don't realize it. So from a harm reduction standpoint, making sure that people who are going to make dangerous choices do so safely is important. And we are definitely here to support that effort, and again, encourage anybody who's needing support to come through our doors and ask for help. We also operate 5 peer support centers around the lake. That is a conduit for services as well. Thank you.
Thank you so much for bringing this to us today and for speaking from the heart. Do we have anyone else?
I will.
Yeah.
I would like to just highlight that our seniors at times get put on pain management. Just the reason why I know is my grandfather was on pain management for his back. He didn't want to get surgery. So they basically just give you this until they pass, basically. And so what happens is people that care, or family members or something of the like will, someone of the like will have access to some of their medication, and commonly fentanyl is pretty normal for that type of pain. So I just wanted to highlight that and make sure to, keep an eye on your seniors, their medication, make sure it's put away, and ensure that they don't overdose as well, because sometimes they don't know they're taking too much, and it doesn't take that much to overdose. So just wanted to highlight that.
Thank you. And do we have anyone in the chambers or in the Zoom room? Come on up.
Good morning. Willie Cepeda, Lake County Fire Chief. We started about 2 years ago the Leave It Behind program, and so we just got another allotment of those. So anybody, predominantly we go out and overdose, we'll leave a kit with them. But I do have them at the station, so if you have somebody that needs them, you can come by our station on Olympic Drive. And like I said, we got a grant and built our own kits. It started with the Safe RX program with Kim Tangerman. And so we have probably given out a couple hundred. We'll periodically go through the homeless encampments and drop them off, but we're kind of a neutral. We're not any threat to them. So we just really do a quick 5-minute in-service, comes with 2 doses, some personal protective equipment, small pocket mask, and it's been pretty successful. So if you guys do know somebody that needs them, you come by our station, we'll give you a kit. Thanks.
Thank you. I just want to ask our FFA students, have you ever been trained on Narcan or know what it is?
I
You
know
do?
what it is,
Do you
but
want
I
to speak
haven't-
into the microphone?
I haven't necessarily been trained, but I have reviewed what Narcan is because of the large amount of overdoses and some of the research I've done for school projects. I've come across what Narcan is and what it does. And I actually did want to ask, did you need to have a concern to need it, or can you just go and be taught so you can be prepared if you ever come across someone having an overdose?
We can just give them out and do a quick insert. So we've got them in the schools, the school nurses have them. So it is widely gotten into multiple hands in the community. So I am totally cool doing a 5-minute in-service for a high school student who wants to keep it in their person, by all means. And like I said, we've had quite a bit of fentanyl overdoses that it isn't what they thought they took, and including liquids and pills and cannabis and everything else. So it is a very dangerous and wide variety of these kids interacting with.
Yeah. Okay.
Thank you. Oh,
Thank you. I just want to say thank you.
You bring up a good point. So SafeRx is a program actually through Health Services, and they also do trainings on Narcan. Unfortunately, I'm not prepared to have any dates of that, but you can feel free to contact Behavioral Health Services or Kim Tangerman, who is the head of SafeRx, if you want trainings. I know she does them periodically, and there's also Narcan available through that program through Health Services.
Okay, great. And we're just at a point in time where we all need to be prepared and trained and have it in our homes and with us at all times. Supervisor Spatier.
I just want to use a moment for hopefully moving things forward. I know that the state of California has denied a lot of fentanyl bills to try and decrease the amount of fentanyl that we're finding in our streets because it's mostly coming from overseas. We need our feds, we need our state to do the job that they need to do to reduce the amount that's here. But on our end, I would just want to keep pushing us, and I know we're waiting for details when it comes to the opioid settlement, but we need to have the conversation about how we're going to invest those funds that we receive from the opioid settlement in order to better prepare, better prepare, but better serve those that need our help. We don't have the services available here. There's a lot of services out of county that we can't connect with people with, but we need to have those conversations. We can't ask our partners to do their part if we're not making sure that we're doing everything we can on our end. And I know that behavioral health works hard, but we also do know that we have some funding available. We've talked about having the conversation. I just want to bring it up again to push us to have this conversation ASAP.
It's underway.
Thank you. Okay. Sam? Oh, sure. Go to the microphone.
So April Gamber, Lake County Behavioral Health. This one hit home for me today because we lost somebody. Many of you may not know her. Her name was Kayla Main. And I remember her approaching me in the streets and saying to me, I'm going to do it this time. I'm going to do it this time. She died. And she died of an overdose. As stated, there are resources out there, but if they're hidden and they're not readily shared and made available, they can't reach the people that need them the most. So I'm sorry, I'm so emotional. She was young, she was a mother, she was a community member, she was someone who was really trying to better herself and made one bad decision. And so we will facilitate Narcan training. We will also link you with resources in the community. We're working hard to get those resources available to everybody, and you are never too young to learn, never. I have a 3-year-old granddaughter, and she can't really do anything, but she tells me, this will make people better, Grandma. And so, please do your part and educate yourself and your friends and your family. It doesn't matter if you're old or if you're young or if you're a senior or if you use or if you don't, or if you have a family member, or if you're just, a citizen walking down the street, that is a missed opportunity if we don't take initiative to educate ourselves. So please do that. Thank you.
Thank you. Thank you, April.
Can I say something as well?
Sure.
Meredith Neuer, Chief Deputy Probation Officer with Lake County Probation. I just wanted to state that we partner with Lake County Behavioral Health and also support the community in their struggles with the substance abuse and all. So, thank you.
Thank you.
Yeah. Oh, great, thank you. Oh, thank you. You're hired. Oh, that was good. That's gotta be the shot. It was. Okay, thank you.
Okay, thank you, Sam.